Okay, there are several other questions, and we'll try to get to them as we get through the program. The next part of the program kind of feeds into the title we have. You know, being a savvy adult about sexuality. That's been one of the things that you all are very much interested in. So we have three presenters for you. Dr. Camille Davis Williams, who is a private practice obstetrician gynecologist here, who treats many of us who are a little older with our issues down there. The second person you're going to hear from is Dr. Elizabeth Burgess, who explores sexuality in older adults with dementia. And the final one is going to be Dr. Donna Hubbard McCree from the CDC, who's going to talk to us about HIV infection. And you're like, what are you talking about HIV for? Well, that's why she's here. She's going to tell you why it's important for those of us in this room. So at this time, I'd like Dr. Williams to come forward, please. Again, when these three speakers finish, we're going to have our stretch break. So bear with us. It's a lot of information, but it's what you asked for.
Good morning, and thank you for inviting me to share a few thoughts about sexuality and intimacy in the older woman from a gynecologist's point of view. My disclaimer, I'm not a psychiatrist, I'm not a psychologist, I'm not a researcher in sexual health, I'm a clinician. And at least 50% of my responsibility is to keep secrets. So today, I may just share a couple. So I'm going to just very quickly do a confidential age poll so I'll know who is participating in the conversation. My daughter was a cheerleader in high school and college, and my son a percussionist. I learned to love the game of football, and I followed them. And from that, I sort of divided my life into 4 fluid quarters, hoping to be a centurion and live to 100. My first quarter from 1 to 25 years old was all about learning the basics, getting comfortable with the game of life, identifying opponents, and working through some of the early kinks. Then, my second quarter, from about 26 to 48, was all about productivity. I earned a few degrees, I produced a couple of kids, and I scored a few touchdowns. And then I came to halftime, and halftime really is my favorite part of the game. And that's 48 to 52. It was filled with a little sweat and some reflections, and gave me a moment to pause and sort of look back at where I had been and where I'm going, and in the words of the University of Georgia coach, to make the decision to keep on chopping wood. When I watched that game for the Rose Bowl, I was in the room with some Sooners, and they interviewed our coach, and our coach, they said, what are you going to do? We're losing so bad. He said, we just go keep on chopping wood. I'm like, oh boy, what is he talking about? And one of the Sooners said, I'm switching teams, because anybody who's ever chopped down a tree know you chop, and the half of your work you get no positive feedback, you just keep on chopping, and that tree will fall. So the next quarter is from 53 to 74, when clearly touchdowns need to be scored, better prioritizing, and giving back, so that the fourth quarter, 75 to 100, can be spent resting, celebrating life, and enjoying watching some of the younger players score some touchdowns. But our Falcons have taught us we better keep scoring touchdowns in the fourth quarter, and even in overtime. So quickly, who in the room is 1 to 25 years old? Anybody? And then what about 26 to 48? Okay, great. And then who's in the halftime phase, 48 to 52? So that third quarter, where we're really scoring some touchdowns. And then the fourth quarter, 75 to 100. Wow! That's just great. So, today we're going to just talk really quickly about halftime and beyond for women. And I want to go very quickly through a quick little look at the goods of a woman. So many acronyms: the pocketbook, the purse, my stuff, the coochie, and I'm not going to dig any deeper into slang. But that organ that looks like a pear, that's actually the womb. That is the crib. And all of the wall of the womb is a muscle. That muscle is there to contract when a woman is full-term pregnant to open up the door, the cervix, to let the baby come through. So I actually call the little inner part of the cervix the foyer, and it is getting up into the womb, the crib. There's a tube on each side that has little fingers that rubs across the ovaries, picks up our eggs, and I call it the superhighway, because when that egg is picked up, it travels to the middle of the tube. With coitus, the sperm is put in. That sperm crawls into the tube, meets the egg, and then the combination comes back to the womb to implant pregnancy. But the real topic today, the ovaries. Those are truly the gems for a woman. It's the comparable of the testis. It gives us all of our eggs, which stop being produced as soon as we hit the menopause. But more importantly, it gives us our estrogen. So menopause and the changes that we'll quickly talk about is all about the death of the ovaries. What happens between 48 and 52 is the ovaries shrivel up and die. When the ovaries die, all of our estrogen goes away. And we are really unique among animals because most animals die when they reach the menopause, when they reach the point where the reproductive life is no longer available. But human females, and I actually think men undergo a pause also, but the killer whale and very few other animals keep living the glory years after the menopause. So we have to earn those years. I once asked my husband, what does estrogen do from your point of view? He said, estrogen is just amazing. It's all about the intonation in your voice. It's about the sway in your walk. It's about the nurturing in your heart. And it's about the soft places where I am hard. And I knew he needed to be a writer. But that's the important hormone of the estrogen. Now, when it goes down, change. So some of the symptoms, I used to be a little bit shy about talking about them in a mixed audience because I always hoped men wouldn't notice. But the headaches, the hot flashes, the teeth loosen and the gums recede, bone loss, mass, and they become more fragile. Vaginal atrophy, which I'll talk about a little bit more. Body and pubic hair become thinner and graze. It loses luster. The breasts droop and flatten. The nipples become smaller. The skin and mucous membranes become drier. The abdomen loses muscle, urinary and stress incontinence. As you can see, a lot goes on. And clearly, those changes can impact our sexuality. So it's very important, I think, that we understand that perception is not always reality. And I want you to know that knowledge empowers. Knowledge will empower women to take better care of ourselves, but it empowers men to participate in healthier and more fulfilling relationships with women. I sympathize with men a lot because they struggle to meet unrealistic expectations that are set forth by Hollywood. And they have to be ready on a dime to ignite bells and whistles and no man can really meet some of the sensationalized expectations. I enjoy. I really enjoyed one of Oprah's episodes. She actually interviewed some Hollywood stars that are most noted for sensual scenes and some porn stars. They showed her how orchestrated this thing is. They had done research to know which gaze, which positions, which motion, the timing of those things, the noises, which of those things generates the most sensuality. It was fascinating to see them stop on cue when they said cut. People, we have been bamboozled. So I really do think understanding reality from perception is important in our relationships going forward. But we women and men can only blame ourselves for this dilemma because we allowed sophisticated trash talk to dictate an unattainable norm. So even more, I sympathize with women because we're the shoppers, the buyers, the consumers, and we're the targets for the tricks of the trade to sell us lust, pleasure promoters, natural pills to help us become ever ready, beautiful, non-aging mannequins. So I'll share one secret from confidential consultations over the decades. During the first 2 quarters of life, when women are extraordinary multitaskers, they become really expert fakers of pleasure. Okay, women, I told it. And about halftime, things have settled down, the children are out of the house, usually haven't quite made it to the caretaking stress and some of the other stressors, but women say, no more faking. And men are confused with that. They're like, well, I'm the same. I'm doing the same. And then it's a time during the pause when we can start having better communication conversations about perception and reality. So during my consultation, some people will say, I'm coming in for a yeast infection. And oh boy, when the door closes, I have no libido, no drive, no interest, no lubrication, no pleasure, no patience, no desire, no sleep, no memory. Doctor, do you have a pill that I can take? So then the discussion changes to, well, what constitutes drive for you and what constitutes pleasure? And so many of them says, I don't know anymore. All I know is I don't have it and I need a pill. So there are so many pharmaceutical initiatives that have stepped up, especially for the baby boomers, to help us with drive and pleasure and desire. So I asked my son, how can I not offend and sort of put the all-natural, bioidentical marketing business into proper perspective? And he put pills on a tree. And he said, just remind people that these pills all come from the manufacturing plant. So don't be bamboozled longer. So now, as I talked about decreasing estrogen and all of the changes that occur in the female, one of the large changes is vaginal atrophy. We know early on all of the folds in the canal that women had to negotiate to learn to put things there. Those folds start to recede when we pass halftime, and the skin inside of the canal dries. So a lot of women will come in and complain of vaginal dryness, and pleasure goes away. Well, the pharmaceutical companies have stepped up. There are so many products out there to address atrophic vaginitis. Some of it is replacing what's missing, which is estrogen, which comes forth in pills and pellets and vaginal inserts and creams and gels. We have lots of options. There's a DHEA precursor that makes a precursor of estrogen. It's now very heavily marketed. There are tons of lubricants, including an interesting lubricant, hyaluronic acid, have been used for decades for eczema and atopic dermatitis in children. And there's a preparation for the vaginal canal that helps to restore the canal. And there is a laser, the Mona Lisa, that helps rebuild the tissue inside of the canal. So I want us to understand the issue of decreased estrogen atrophy and how it can impact intimacy, but know there are several things, hormonal and non-hormonal, that can be done for restoration. The other thing I wanted to quickly mention is desire and libido. But I want you to always think of some of the myriad of triggers which impact desire. Well, testosterone is really the hormone that helps to control that. And once our ovaries die and our adrenals become sluggish, it really goes down. Well, replacing it brings it back, but not without side effects. So that is something that has to be discussed with your provider. And then the knowledge that so many medication decrease and cause the increased dyspareunia and atrophy. The birth control pills, the statins for decreasing cholesterol, blood pressure meds, reflux meds for GERD, anxiety and depression meds, stress, fatigue, finances, caregiving, no time, no place, all of that impacts desire. And it's important not just to expect one simple little pill to fix it. So communication is very important. There are several medications, some for premenopausal women and replacing testosterone that are available. But remember date nights, like planning a date with your mate and reminding yourself of who you used to be so that you can reclaim some of those special moments, creating the right ambience to generate desire. Don't forget the vaginal interest issues, and don't forget to de-stress. And you have to address insomnia. Sleep deprivation is really bad. I mean, it really can wreak havoc on mood and ability to perform in any situation, and that too can be addressed. So pleasure is unique to everyone. There's vast research, especially now going on due to the surge of drug addiction. So I defer to the psychologists and psychiatrists regarding safe medication to impact pleasure. But I just wanted to share with you one thing that I learned very early, the power of touch. My mother was just the most amazing nurse ever placed on the earth. She was brilliant, she was compassionate, and she actually knew how to teach us to be more compassionate. Well, she was the director of nurses at a nursing home in my small South Georgia town, and she had me come up to do a summer research project. She chose 3 or 4 patients, and she said, I want you to ask them their goals. So I went to each of them, and they were, kind of down in the chair. They didn't respond to me. A couple kind of looked up at me as I was talking. And I came back and I said, now, Mama, am I going to waste my whole summer with this? And she said, well, no, when you come back next weekend, you will have 2 goals that I'm going to give you that each of them can attain. So this time you go and you tell them the goals that they can attain. And so I went and I told them, and I actually got a look up for every one of them. And I said, well, they looked at me, engaged me a little bit, but I'm not sure this is going to work. So she said, the next time, you've got to touch them. You can hold their hand, you can rub their arm, but you got to touch them when you talk. Every one of those patients, as I engaged them through touch, sat up. We had a real conversation, and I really knew that I would impact who they were. So then my mother, for 2 or 3 weeks, said, oh my goodness, every day they're wondering, when is that little girl coming back? So when I went back, every one of them attained those goals. So I don't want you to forget the power of touch. The power of touch is profound. It heals, it connects, it nourishes, and it soothes. We don't have to compete with the Hollywood people to get a major internal satisfaction and connection from those we love. And one other little secret I'll tell you from the consultation room. Some of my ladies whose mates are, taking Viagra and lots of meds for erectile dysfunction, some of them come in and say, please tell me what I can do so that this doctor won't give him any more of that stuff. And, I'm like, help me to understand where you're coming from with this. And, not to be self-serving, every one of them say, well, I don't want to risk him in any way. And when they would realize it's a safe place, you can talk, they would share that the foreplay that their partners used to be experts in the early part of their relationships. And women know when all the dots are connected and you don't intend to engage in anything, and then you're like, okay, what am I doing? Because our men knew how to connect the dots. And so once there were challenges for the men, they tended to get back to paying attention to what truly drove pleasure in women. So I just want to take some of the stress off of men and let you know that you still have the power. And our women, when they are prepared and restored, it creates a more wholesome relationship. So I want you to focus on making informed choices, to understand the seasons of life and the changes which occur naturally, to seek individual consultation for restorative options, to make healthy lifestyle choices. I wish I had time to talk to you about HPV, but no, it's big. Look at head and neck cancer. Remember the power of touch and connecting the dots, and understand options to make life worth living rather than constantly focusing on just keeping death away. And my last comment, I traveled to the continent of Africa with Ambassador Andrew Young. I got back maybe 2 weeks ago. I've traveled with him maybe 6 or 7 times on mission trips. He's revered on that continent. And this time, it was really a little concerning to me because clearly people all over the world are a little bit laughing at us now. And Ambassador Young, who every time I've gone, some life-altering comment he would make that I would carry back with me and share with my people. But he said, well, the U.S. Constitution does not guarantee happiness. It does guarantee the pursuit of happiness. So he shared with the president of one of those countries The people in this room are in hot pursuit, and I hope you will be too. And hopefully, I'll see you in overtime.
I think we have time for a few questions for Dr. Williams. Any questions? Hostesses?
She has one.
Okay.
I have one about how estrogen impacts the brain. There's so much interesting research and data that really never really got out to the public. In the 80s, the huge study on how safe hormonal replacement was halted because of increase in breast cancer and heart disease. But it was halted inappropriately. When it was halted, tons of women gave up on replacement. Thousands of women died since that time with osteoporosis, hip fractures, etc., because estrogen helps bone strength. And when some of that data was looked at, women who had had a hysterectomy on estrogen alone had no increased breast cancer. And the ones who got breast cancer had a nicer cancer that responded better to chemotherapy. Nobody came back on the news to tell anybody about that. No increase in heart disease among women who started early in the menopause. However, the study was for women aged 63 and older. So lots of updated information needs to be had on how safe replacement is, and for us to keep doing more research to learn how to replace in a safer way. One little laboratory study showed an area, the hippocampus of the brain, among lab animals would shrink from the lack of estrogen. And we know that's where name recall resides. So you'll hear your girlfriends say, I can't remember anybody's name. And so we know there is an impact. And there's controversy now on whether or not estrogen will have a cognitive benefit or harm as we go forward. So stay tuned.
So that was one of the questions, and this is,
Yes, she was asking, the GYN said, since I'm past menopause, I no longer need to see a GYN. Absolutely false. I mean, more than just the crib is all menopause represents with the uterus, the ovaries shutting down. We still have breasts, you have your thyroid exam, and more importantly, we have ovaries. We almost never find ovarian cancer until it's too late. So if you see your GYN, have your annual exam, let issues of our female organs be stalked and kept up with, from fibroids to any abnormal bleeding to any masses that occur that could be ovarian to relationship issues, so I can keep secrets longer. You should see your GYN. Does hysterectomy take away from probably sexual satisfaction? It does not, in my opinion. The uterus is the crib. So it's very interesting over my 30-plus years of practice. I would take care of many women after hysterectomy. Some of them would come in and say, Doctor, he thinks I'm in here for a pregnancy test. I'm like, that's between you all. You know, I'm not in that. And so they just don't know that the crib is what's gone. And when I counseled, one woman brought her husband in because he thought she was going to be changed after the menopause. I helped him to understand the power and the function of the ovaries, the fact that we can replace some of what's missing, and taught them a little bit about how to be restored in a healthy way. So he knew her bleeding was crazy. It could not continue. It had to go. He said, well, doctor, would you just shut the back door for me? I said, I have you. because he didn't realize at the top of the vaginal canal, once the womb is removed, it's sewn shut. And the cuff creates an area which helps for, unless you're told, someone wouldn't know that that organ is missing. But he was so attentive and such a thinker, he's like, if you take that out and all of that is open, please shut the back door. Yes. How long for estrogen replacement? I am trying to get our academic institutions to look at some replacement that I think is going to be very valuable. Some of the preliminary data shows that the replacement in a healthy way, including the small amounts of testosterone in women, impacted diabetes in a positive way and even heart functioning in a positive way. Some women say, I want to live, but I need quality of life. And so some women continue taking hormones indefinitely. But if you read the data stopped after 5.6 years. And so the data will say hormonal replacement is safe for 5.6 years. And I think that number will continue to increase over time.